Hi, Eugenie.
Hi Camille, so today we're going to talk about Nerium oleander. Do you know anything about this plant?
Yeah, Nerium oleander, commonly known as oleander, is an upright, rounded evergreen subtropical to tropical shrub, belonging to the family Apocynaceae. This seasonal bloomer can have purple, pink, or white five-petal flowers in cluster, and its size depends on the place it's growing, in pot or soil. It is native to Mediterranean region, but it's cultivated worldwide. But oleander has this huge downside. Oleander is among the most toxic plant, posing serious risk to animals and humans due to its potent cardiac glycosides. Do you know anything about its toxicology?
Yes, of course. The primary toxic compounds are cardiac glycosides, particularly oleandrin, nerium, and digitotoxygenin. Those compounds inhibit sodium-potassium ATPase, leading to significant impact on the cardiovascular system and also profound systemic effects. You should be careful because humans and animals are at risk, and the ingestion of any part of the plant, even in small amounts, can lead to severe toxicity with potentially life-threatening effects. And the common clinical signs being gastrointestinal, cardiovascular, and neurological symptoms. Also, poisoning may occur for dermal exposure, causing irritation.
Okay, well, I remember a clinical case about this toxic plant.
Oh, well, fascinating. Tell me about it, Camille.
The poisoning episode occurred in a dairy farm in Italy where 50 lactating cows were affected. At first, the breeder noticed that the lactating animals displayed discomfort with many warning clinical signs and decided to remove their feed, suspecting a possible feed poisoning. The following day, some cows worsened. Thus, a symptomatic therapy with rehydrating fluids and atropine was performed. However, in total, 13 cows died the following days. Because of such an impact, a general examination of the herd was performed. The observed clinical signs after clinical examination were varying degrees of depression and weakness, as you can see in the picture, many subject in sternal decubitus with lower ears, atonic rumen with mild bloating, lack of rumination, along with abdominal pain like colic, diarrhea, hemorrhagic stools, and tachypnea. At this point, a careful check of the remaining feed ration was performed and the farmer revealed the presence of intact and fragmented oleander's leaves mixed into the hay.
And what about the additional test results?
About the complete blood count, ALP, LDH, CK, total protein, urea, and creatinine were dramatically increased, and as regards ions, calcium was slightly diminished, while chloride and magnesium were augmented. About the ECG, we observe an atrioventricular block of first degree and a paroxysmal ventricular tachycardia with ventricular arrhythmias. And with the necropsy, we have found a diffuse congestion of visceral organs, mild hemorrhage in the ventricular endocardium, edematous lungs, mild hydrothorax, hydropericardium, and ascestus. With the histological examination, we showed a cardiac, renal, hepatic, splenic, and gastrointestinal abnormalities. So the hypothesis of oleander poisoning was confirmed by chemical analysis, and a symptomatic therapy to reduce cardiac abnormality was conducted. After 6 days, the remaining 37 cows came to complete recovery.
What are the main important things to remember about this plant?
Well, in a nutshell, oleander poisoning is characterized by polymorphous symptoms whose onset and severity vary according to the amount of active principle ingested. As oleander contains cardiac glycosides, the heart is the most effective organ.
Okay.
Indeed, the inhibition of the sodium-potassium ATPase pump in cardiomyocytes lead to conduction blocks and ventricular arrhythmias. However, toxic glycosides may induce the release of pro-inflammatory cytokines that facilitate degeneration in the heart, kidney, liver, and also gastrointestinal organs.
Yeah.
But understanding the risk and implementing effective safety measures is crucial to prevent oleander-related toxicity in veterinary contexts. If exposure is suspected, please prompt veterinary care is essential to minimize harm and improve outcomes.
So thank you for watching.
Yeah, thank you.
Please be careful with your animals.